Hello, friends. Hope all of you are doing well. Today we've got the date of the NEET 2023 examination, so that should motivate us further to keep working hard. All right. Now, as far as today's discussion is concerned, we are continuing with our vital pulp therapy series. This should be formulating the part two of the vital pulp therapy series, in which we'll be discussing the next important concept. In the previous discussion, we discussed SWEC pulpotomy or partial pulpotomy through a very important AIMS senior residency MCQ. Okay, today we'll be taking the concept one notch further. So, as always, let us see the next important MCQ. All right. So, 12-year-old presents with a complicated crown fracture of upper right canine 3 days after the traumatic injury. Now, the choice of treatment shall be. Okay. So, let us look at each and every important hint that the examiner is giving us, and let us build the concept and reach the correct answer. Okay. So we have a 12-year-old patient who is presenting with a complicated crown fracture of the upper canine. And the time duration is 3 days after the traumatic injury. Okay. So let us see. We are in a situation in which we have the tooth has the canine. All right. So we have the canine in which there is a complicated crown fracture. That means there is exposure of the pulp. The pulp is exposed. That's number one. That's number 1 point. The patient is 12-year-old. Now, what is the age of eruption of the canine? 11 to 12 years. Okay. And what is the time at which root end formation is completed? That is 13 to 15 years. So we are dealing with, the patient is 12 years. So we are dealing with an open or an immature apex case. Okay. So as a clinician, our aim is to ensure that physiologic root end development takes place. Now, the problem here is that the patient is presented 3 days after the injury. Now, what happens is that after 48 hours, the inflammation spreads to deeper parts of the pulp. That is, within the first 24 to 48 hours, it is restricted to the superficial 1 to 2 millimeters. So, therefore, the predictability of treating the uninflamed healthy pulp is much more when you are doing the treatment, when you are doing the vital pulp therapy procedure, that is pulpotomy, within the first 48 hours, preferably within the first 24 hours, but within the first 48 hours also, it is acceptable. But the problem is that once the 48-hour time gap is elapsed, the patient presents to us after 2 days, then we don't know to what extent, to how much deeper the inflammation has gone inside. That is, after 48 hours, the inflammation in the pulp might as well just go deeper inside the coronal pulp chamber and into deeper parts, into the root canal system. So the success rate decreases. Success rate of pulpotomy decreases. However, as a clinician, as I said, since we are dealing with an open apex case, we must do all our efforts to preserve the vitality of the radicular pulp. So what do we do here? We do a full pulpotomy. That is, we do a cervical pulpotomy. We just simply open the pulp chamber, okay, and we remove the entire pulp right up to the CJ, that is right up to the canal orifice. So if we are to just see this too, this was the crown part, okay, this was the crown part, and this, if I just project the open apex, this is an open apex, so root end formation has not taken place. So, and this is the pulp. Now, this is the CJ. This is the coronal pulp. So, we are supposed to remove this entire pulp. Entire pulp is completely removed right at the level of the CEJ. Now, this is a point which is a reproducible point. It's a point of anatomical and surgical convenience, right? And that is why we choose it. And obviously, we want to go as deep as possible so that at least, just in case we are lucky enough, the inflammation of the pulp has not gone deeper inside, we can still be treating, we can still be, saying that, okay, let us just hope that we are treating a healthy pulp that remains inside the root canal, and just hope, keep the patient under follow up, and just hope that root end formation does take place. Now, the success rate is significantly less. The success rate of a full pulpotomy, the success rate of a full pulpotomy is only 75%, as opposed to the success rate of a partial pulpotomy, which is up to 95%. But we are taking this chance. We are taking this chance because just in case we are successful, we would be ensuring that apexogenesis has taken place. Okay. So here the correct answer would be full pulpotomy. Full pulpotomy, also the other word or the synonym is cervical pulpotomy. So whatever option is given, either full pulpotomy or cervical pulpotomy, that is the correct answer here. All right, friends. So with this, I will end today's discussion. And as I said, the date for your NEET 2023 is out today, and that should just keep, you have to keep up your motivation and keep working hard. Best wishes to all of you.